Hi, my name's Dr. Keith Miller. I'm a first-year child and adolescent psychiatry fellow here at Mayo Clinic. This is my 9th year here in Rochester as I did medical school as well as a 4-year general psychiatry residency here as well. And I'd like to welcome you to Generose. The Department of Psychiatry and Psychology practice is located here, as well as on the 11th floor of the Mayo building. Generose houses all of our inpatient psychiatry units, as well as some outpatient services, research, and some trainee workspaces. Residents spend the majority of their time during the PGY1 and 2 years here, as well as at the adjoining St. Mary's Hospital and Emergency Department. We have the pleasure of giving you an inside look into not only our programs, but our entire department. So let's get started. As you walk into the Generose building, you'll be greeted by the legacy that is Sister Generose. Even though she passed away in 2016 at the age of 97, her tireless work on behalf of patients and the staff of St. Mary's Hospital lives on. Her hospital ministry focused on perpetuating the Franciscan legacy, specifically nurturing the values of respect, integrity, compassion, healing, teamwork, innovation, excellence, and stewardship among all Mayo Clinic staff. You'll find the crowning jewel of the Generose building on the first floor, the Atrium. Complete with skylights, this place offers a welcoming area for both patients and staff to spend time, eat lunch, and enjoy the natural sunlight. This is the Psychiatry Resident Workroom in Generose. You will also find residents from other departments or medical students rotating in psychiatry on the Psychiatric Emergency Department team or the Consultation Liaison Service. This is a great place for curbsiding your fellow residents about patient cases or just catching up. Interns and second years primarily occupy the space, but it isn't uncommon for third years to miss the workroom once they begin working downtown in the West 11 workspace. The area is slated for some construction and rearrangement, so it may look a little different in the next several months, but the spirit will remain. The Consultation Liaison and Mood Fellows office is also located in Generose. This too will look different once the remodel is complete. The Mayo West 11 workroom is where the PGY4 residents spend their outpatient year. As with the Generose workroom, this is where third-year residents spend their time between patients and catching up with other residents. The Psychology Fellows workspace is also in the Mayo building. This space got a major facelift in the fall of 2019, which made the room feel bigger, even though they were able to add individual workspaces. This space is regularly used for completing non-clinical work, eating lunch, or enjoying each other's company. The residency has 2 call rooms located on the 3rd floor of Generose for junior and senior residents. They are conveniently located near the resident reading library and workroom to provide a quiet haven for work or rest during call hours. They're equipped with computers, webcams, printers, showers, beds with fresh linen, scrubs, and a TV just in case you have some downtime during your call shift. Our Child and Adolescent Psychiatry Inpatient Unit cares for children and adolescents ages 18 or younger with acute psychiatric needs. Interdisciplinary teams include psychiatrists, nurses, social workers, psychologists, occupational therapists, recreational therapists, and child life specialists. Trainees have the opportunity to lead these teams to facilitate comprehensive assessments, as well as to develop acute and longitudinal treatment plans for their patients. Additionally, we do everything we can to involve families in the care of their child throughout the hospitalization period. As a PGY1 and 2 resident, you will complete a total of 2 4-week rotations on the unit. As a child psychiatry fellow, you will spend 2 4-week rotations in your first year of fellowship and 2 4-week rotations in your second year. The unit is scheduled to be remodeled in the next few weeks. Some of the changes to the patient rooms include new furniture, built-in desks, and TVs. These TVs will have access to the Mayo Clinic education channels. Other updates include a remodeled nurses station, latency and adolescent group rooms, a lounge and dining area, a new reward room, and a break room. Currently, we have 2 seclusion rooms. During the remodel, 1 seclusion room will be redesigned to be a destimulation room. The Intensive Addiction Program is a 4-week intensive outpatient treatment program located on the first floor of Generose. The program includes process groups, education groups, a complete substance use history and psychiatric evaluation, medication management, and individual therapy. As a PGY2 resident, you will complete a 4-week rotation with the option of completing an additional rotation in your PGY4 year. Addiction fellows will spend the majority of their time here on this unit, and their offices are also included in this area. Generose 2 West is the location of our Adult Transitions program, which is an intensive outpatient therapy program for those needing treatment after being in the hospital or emergency department, or those having difficulty managing symptoms in the outpatient setting. The program team works with participants to identify individual needs, learn coping skills, and set goals. Group therapy is the primary treatment method with weekly individual sessions. 2 West is also where the long-acting injectable clinic, clozapine clinic, and bridge clinic for short-term follow-up are located. Generose 2A is the central location for department administration, the mood clinic, the mood program, and ECT appointment check-in. Lastly, as a PGY4 resident, this is where you would see the outpatients you choose to carry over from your PGY3 year in the General Psychiatry Outpatient Clinic. The adult and pediatric pain rehabilitation clinic programs focus on a multidisciplinary approach to increasing function in the face of chronic pain and other chronic symptoms. The pediatric patients, ages 13 to early 20s, spend a lot of their time in room 205 with the awesome beanbag chairs, and are often able to enjoy lunch outside in the courtyard or up in the first floor atrium. Trainees rotating within the PEDS PRC have opportunities to observe and contribute to the youth programming, parent programming, family groups, and rounds, as well as to observe sessions with other subspecialties. Trainees can get involved in ongoing research projects with the PEDS PRC team. Both the PEDS and adult PRC programs use the gym for various activities, including mind-body activities like yoga, tai chi, and mindful walking. Some of the physical therapists also take patients into the gym to work on getting back to activities they love, like basketball or tennis. The rounds room is where the multidisciplinary team gets together in the mornings to discuss each patient in order to optimize their care and experience in the PRC programs. The team rooms are where much of the adult programming takes place. Adult patients receive psychoeducation on diverse topics, including cognitive behavioral therapy, acceptance and commitment therapy, and behavioral approaches to chronic pain management. We also discuss topics such as medication management, insomnia management, sexual health, and spirituality as they pertain to living with chronic pain. Thanks so much for joining us on our tour. We hope we were able to give you a sneak peek into how and where we work. Should you have any questions, please feel free to call or email.